Brothers MD. In this video, we will be discussing the PARADIGM-HF trials. The study compares angiotensin-neprilysin inhibition with a new drug, LCZ696, versus ACE inhibition alone with Enalapril in patients with systolic heart failure.
The study was funded by Novartis and published in the New England Journal of Medicine on August 30th, 2014, authored by J.J. McMurray et al. Now let's have a closer look.
LCZ696 is a compound made up of angiotensin receptor blocker valsartan and a neprilysin inhibitor, AHU-377, known as sacubitril. AHU-377 inhibits neprilysin, which is responsible for breaking down vasoactive and natriuretic peptides such as ANP and BNP into their inactive metabolites. This inhibition of neprilysin causes an increased buildup of ANP and BNP, which in turn reduces blood pressure. Blood pressure is reduced through sodium excretion and reduction in intravascular volume.
The objective. The objective of the study was to compare angiotensin receptor neprilysin inhibitor with LCZ696 to Enalapril in heart failure patients with reduced ejection fraction of less than 40%, looking at risk of death from cardiovascular causes and hospitalizations for heart failure. The study design. The study was designed as a randomized, double-blinded study with a sample size of 8,400 patients with class 2, 3, 4 systolic congestive heart failure. With a duration of 27 months, the trial was stopped early.
The results of the study. Looking at all-cause mortality. Enalapril had 835, while ARNI had 711, a risk reduction of 16%. Looking at cardiovascular cause of mortality, Enalapril had 693, while ARNI had 558, a risk reduction of 20%. Hospitalizations. Enalapril had 658, ARNIs had 537, a risk reduction of 21%.
Secondary outcomes. There were decreased symptoms and physical limitations from heart failure seen in patients. Blood pressure measurements at 8 months were lower in angiotensin receptor neprilysin inhibitors by 3 mm mercury. The side effect profile. ARNIs versus Enalapril. There was an increase in the number of patients with hypotension. There was reports of non-serious angioedema, as well as decreased proportions of renal impairment, hyperkalemia, and cough as compared to Enalapril.
The conclusions of the study. Angiotensin receptor neprilysin inhibitors with LCZ696 was superior to ACE inhibitors alone with Enalapril at reducing risk of death and hospitalizations for heart failure patients in the study. ARNI had an improved symptomatic profile without any unacceptable side effects when compared with Enalapril.
The promising results of the PARADIGM-HF trial offer new hope for managing patients with systolic heart failure. It introduces a new drug class that proves to be beneficial even for patients receiving the best current treatment.
However, there have been speculations regarding blockade of the neprilysin pathway, leading to long-term side effects. Neprilysin inhibition leads to an accumulation of beta amyloid and possibly increases the risk of Alzheimer's disease in the future.
For more information regarding the Paradigm HF trial, please visit the link posted below.
And thank you for watching.